Hello everyone, my name is Shilpa Devi and I'm a GI fellow from LUMS Pakistan. Today I'm going to present Virtual General Club on predictors of disease activity during pregnancy in women with IBD, a Danish cohort study, and which is under the IBD Club founded by the IBD Droids along with the South Asian IBD Alliance. So, the inflammatory bowel disease activity during pregnancy can increases the risk of stillbirth, premature birth, and low birth weight. And up to 66% of the women with IBD may experience a flare at some point during their pregnancies. So, pre-conception counseling is needed. And there are risk factors in some studies that if there is a previous disease activity, it's a predictor of renewed disease activity in ensuing pregnancies, and their disease activity at the time of conception and IBD phenotype. But there is no robust data for it. And also it's unclear that which clinical criteria should be used to guide risk stratification in clinical algorithms. So, the primary aim of this study is to identify risk factors that predict disease activity during pregnancy in women with IBD, and the secondary aim was to elucidate the pregnancy outcome of women with IBD experiencing disease activity during pregnancy. So it's a prospective cohort study and which is done at the outpatient clinic at the Department of Hepatology and Gastroenterology, Aarhus University, a tertiary IBD center from the 1st January 2008 to 30 March 2021. And there is a physician global assessment was done to assess the disease activity during the preconception period, that is 6 months, and at conception and in each trimester of pregnancies. So there were 442 patients were diagnosed with IBD through the medical record, and in which 18 were excluded due to the incorrect diagnosis, and also the 44 patients were excluded due to not have been pregnant after being diagnosed, and 2 excluded due to the multiple pregnancies. So there were total number of patients were with IBD 378, in which there were number of pregnancies were from 2008 to 2021 were 609, and in which there were 348 patients were with ulcerative colitis and 255 patients were with the Crohn's disease. And out of 255 with Crohn's disease, 86 patients had flare at any time during pregnancy, and 69 patients had disease activity pre-conception. And out of 348 patients with the ulcerative colitis had 195 patients had flare anytime during pregnancy, and 99 patients had disease activity pre-conception. So the basic results were that patients with ulcerative colitis were having the pregnancies of 352 and Crohn's disease with 25577, and there were extensive ulcerative colitis. Most of the Montreal classification patients had with the ulcerative colitis was extensive, and with the Crohn's disease there was oleocholic. And with UC, the patients used 5-ASA and corticosteroids and budesonide, and with the Crohn's, the patients used thiopurines and biologics. And there were maternal demographics and clinical characteristics are shown in this figure, and also the main important thing that smoking was more common among females with Crohn's disease. And there was a Montreal disease classification was similar between women with or without disease activity during pregnancy, and there had similar median fecal calprotectin measurements in the first and second trimester, as they are showing the differences between, and they however showed a statistically significant difference in fecal calprotectin in the third trimester, with a median fecal calprotectin of 661 and 323 for UC and Crohn's disease respectively. And the disease activity was associated with the lower birth weight, higher prevalence of C-sections, and fetal growth retardation. Women inflammation throughout pregnancy gave birth to children with a median birth weight of 3.4 kg, while women experiencing disease activity gave birth to children with a median birth weight of 3.3 gram, 3.3 kilogram, yielding a statistically significant difference of 160 gram. that is showing the significantly value. And the results, important results showed that patients who had disease activity in previous pregnancy had developed disease activity in subsequent pregnancies with the odds ratio of 3.2, and the patients who were in remission in previous pregnancies had odds ratio of 0.4 in subsequent pregnancies. And the disease activity within 6 months of conception if patients who have experienced a preconception flare compared with a woman in remission had an increased odds ratio of 5.3, and the patients who had disease activity within 6 months of conception but have who had disease activity at conception have odds ratio of 2.8 to develop disease activity during pregnancy as compared to patients who had attained the remission at the time of conception with the odds ratio of 0.4. And ulcerative colitis was associated with a significantly higher risk of experiencing disease activity during pregnancy, which is with the odds ratio of 2.6. So disease activity during pregnancy is associated with adverse outcomes, that is fetal growth retardation, low birth weight, preterm birth, and cesarean sections. Use of biologics twice in Crohn's disease patients and 3 times in women with disease activity with Crohn's disease. Risk of flare in subsequent pregnancies was 3 times if there is a past history of flare in pregnancy, and maintenance of remission during pregnancy 3 times if past history of remission. Preconception, that is less than 6 months before pregnancy, disease activity is also a predictor for re-experiencing disease activity, that is 5 times. Risk of flare more in UC as compared to Crohn's disease. Prevalence of malformation of 9% ulcerative colitis and 7.4% Crohn's disease. But there were some strengths and limitations related to this study, and strengths were that this is 13-year study period and there were thorough review of medical record by a single physician that validates data and that decrease the misclassification bias and no inter-observer variation. And Danish registries are nationwide, little missing data and minimal selection. The limitations were that study populations from tertiary center and could thus be skewed towards more complicated IBD, and there were potential risk of falsely increased odds ratio due to increased awareness of a disease activity in a second pregnancy following a pregnancy affected by a flaring. Odds ratio are higher and thus cannot be interpreted as risk ratios when, as in this study, the outcomes are common. So the conclusion is that there are predictors for experiencing of the disease activity, that there was history of pregnancy complicated by disease activity within 6 months prior to conception and or at conception, and patients having experience of disease activity who has ulcerative colitis phenotype. So in that way we can help patients in pregnancy planning and optimizing monitoring of the IBD treatment.